We ran a session organised by the Palliative Care Work Group looking at end-of-life issues, and particularly because this is the first time that the MASCC conference has been in the Southern Hemisphere and in Adelaide, that we looked at Australian issues. And so we looked at what is a good death, and I think that there are an increasing understanding that a good death is not one concept, that we all live our lives and probably want to die in a way that we've lived our lives. But how do we make the best dying for people was part of the study. And then we looked at specific groups. We looked at the large push that's been for advanced care directives across the world, and particularly in Australia. There's a lot of work being done on helping people write down what they might want, to talk about their wishes and values in life, particularly as it relates to end-of-life decisions. And then we went on to talk about rural and remote communities in Australia and how the ethos and what we do is similar, but the geography can make such a difference. Some of the simple things are really the obvious. You ask people what they want, and often people have actually thought about a lot of these issues. If you have the right questions and you give the right time to explore, if the worst were to happen, how would you see things unfolding? Those sort of questions. Some people have never thought about it. It surprises me. I can meet a 90-year-old who has not ever thought that death might be part of their living. You know, it's something that comes at an end, and yet we're all going to die, and most people have done some thinking about it, and that can be a really useful entry into working out what is appropriate, that we don't do things that are disrespectful or waste valuable time. Because what we saw was that what doctors think their patients want is quite different from what people themselves want. There was a lot of talk about doctors think that patients are really concerned about where they die, and certainly our governments have spent a lot of time talking about home deaths, and if you ask well people where they would want to die, most of us would say that we wanted to be in our own homes. But when it comes to asking those questions of people who might be looking at the end of their lives, it's not the same importance for them. They're much more worried about being comfortable, having the right people around them. Of course, we would want good symptom control. You don't want to have terrible pain, but it's a sense of completion in life, a sense of having made a difference too.